Hello everyone, I'm Dr. YousufuddinAli Khan. I'm a third-year resident in the Department of Pathology at Detroit Medical Center. Along with me it is Dr. Vishaka Pardesi, fourth-year resident, Dr. Ahmed Alrajjal, Cytopathology Fellow, and Dr. Vinod Shidham, an attending in Pathology at Detroit Medical Center, has participated in the research, and we're going to present on diagnostic utility of esophageal brushing in pill-induced esophagitis. So, pill-induced esophagitis, or drug-induced esophagitis, is a very common cause of heartburn, esophagitis, and esophageal ulcer. Heartburn is one of the top 10 complaints of patients to have a physician visit in the United States. It has a huge economic impact on United States healthcare system in terms of diagnosis and treatment. Pills like iron sulfate, potassium chloride, bisphosphonate, amlodipine, and alendronate are known to have direct toxic effect on the esophageal mucosa. Direct toxic effect is, as the name implies, the direct impact of the pill physical material on the surface of the esophageal mucosa. The pill material is usually lodged on the surface, and that is considered as a foreign body to the mucosa and creates an inflammatory response, causing esophagitis. And if this deposit is prolonged enough, it can cause ulceration as well. Multiple predisposing factors like multiple sclerosis, diabetes, and autoimmune disorders are known predisposing factors. The application of cytopathology of esophageal brushing has not been explored widely to evaluate for esophageal pill esophagitis. In this study, we analyzed the diagnostic utility of esophageal brushing for the diagnosis of pill-induced esophagitis. And for that, we used pap-stained direct cytology smears of 252 brushings that were analyzed from 2012 to 2020. Of the 252 samples, 42 esophageal brushing samples from esophageal ulcers were selected. These cases on clinical follow-up showed improvement or did not develop squamous cell carcinoma. The cases in their original diagnosis were interpreted either as pill esophagitis, 9 cases, or atypical cells present, 18 cases, or candida esophagitis in 8 cases in patients without any history of immunosuppression or without a suspicion of fungal infection. The remaining 7 cases were reported as negative for malignancy without viral cytopathic effect, and these were designated as the non-specific ulcerative esophagitis. And then we analyzed the presence or absence of the amorphous crystalline debris. Amorphous crystalline debris is the actual pill material which on cytology presents as amorphous crystal debris. And if we see in the pictures, this amorphous crystal debris can be seen here in figure 1 as a dark brown crystalline material which has refractile properties, and it is seen admixed with the esophageal mucosa, which is present here as the superficial squamous mucosa. In figure 2, we can also see that here we have a dark purple crystalline material, that is amorphous crystalline debris, admixed with the squamous epithelium and inflammatory cells. In some of the smears, we also found just the presence of this crystalline amorphous debris, which can be shown here in figure 3. And in some cases, like in figure 4, this amorphous crystalline debris can be seen admixed with inflammatory cells and not in direct contact with the squamous epithelial cells. So the results were analyzed, and as we can see in this table, patients with a history of pill were present or absent, and then there is presence. We analyzed the presence or absence of amorphous crystalline debris in these patients. So 27 patients who has a history of pill ingestion showed the presence of amorphous crystalline material, and 11 patients did not. And when there is no history of a pill ingestion, the amorphous crystalline material was not present. And when there is no history of pill ingestion, the amorphous crystalline material was not present in 4 of those cases. And so we can imply that pill esophagitis can be suggested based on cytopathological evaluation of esophageal brushing. The amorphous crystalline debris admixed with inflammatory cells and reactive squamous epithelial cells is a diagnostic clue. However, as a potential sampling artifact, amorphous crystalline debris may not be detected in some cases. The presence of reactive squamous epithelial cells with different shapes, including tadpole shaped cells with pill esophagitis may lead to misinterpretation as atypical cells. However, the nuclear details of such cells were not consistent with neoplastic process. Providing clinical details with reference to consumption of pill usually associated with pill esophagitis is recommended for precise cytopathological interpretation. Plus, esophageal brushing also have a direct advantage by actually brushing the esophageal mucosa, resulting in removal of the pill material that significantly improve the clinical symptoms of the patient, and this results in less frequent esophageal biopsies for diagnosis and also less frequent use of antacids and anti-inflammatory drugs. Thank you.